All right, let's jump right into a topic that every single one of us in medicine deals with all the time: gastrointestinal distress. Stomach issues. And it might seem simple, but honestly, it can be one of the most deceptive challenges we face.
I mean, we all know the scene, right? A patient comes in, they're vomiting, they have diarrhea, and our brain immediately goes to gastroenteritis. But the really critical question we have to force ourselves to ask every single time is right here. Is it just a stomach bug, or is there something much more serious going on?
And that's exactly why we have to learn to look beyond that easy diagnosis. Because these super common symptoms, well, they can just be the tip of the iceberg. What's hiding underneath could be a massive problem that needs our immediate attention. This really gets to the heart of what we're talking about today: unmasking the dangerous mimics. These are those critical situations where the GI symptoms aren't the real problem at all. They're actually just a smokescreen, hiding something truly life-threatening. And when I say life-threatening, I am not kidding. Just look at this list of what could be hiding behind that smokescreen. We're talking about a stroke, carbon monoxide poisoning, a heart attack, new onset diabetes, even DKA. These are all major medical emergencies, and that simple complaint about nausea could be your one and only initial clue. So here's a classic and, frankly, a terrifying example of a mimic. A patient complains about some discomfort right in their epigastric region. It looks for all the world like simple indigestion, but it could actually be their heart. We absolutely cannot afford to miss a heart attack that's presenting as stomach pain.
So the clinical move here is crystal clear, and it's totally non-negotiable. For certain high-risk groups, like elderly women and patients with diabetes, that epigastric pain has to set off alarm bells for a cardiac workup. For these patients, getting an EKG isn't just a good idea, it is a critical step to rule out a cardiac event.
Okay, so knowing that these mimics are lurking out there, how do we begin our investigation? Where do we start looking for clues? We start by decoding the vital signs. These numbers are our first and, you could argue, our most important set of clues.
And the very first vital sign to really zero in on is tachycardia. Now, it's more than just a fast heart rate. It's a key indicator of the patient's fluid status, their volume, and their overall level of distress. You can think of it as the body's alarm bell. And here is the key insight, the thing you have to remember. Tachycardia is often the very first clinical sign that something is going wrong. Long before the blood pressure drops, before the patient even looks that sick, the heart rate starts to climb. It's the body's earliest attempt to compensate.
This chart just shows that relationship so clearly. A patient with a normal heart rate is probably not that dehydrated. But as you can see, as that dehydration gets worse and worse, the heart rate climbs right along with it. It's a really direct and reliable marker of how much trouble they're in.
So if tachycardia is the alarm bell, what's our first move? It's this beautiful, simple, and effective feedback loop, the fluid bolus protocol. You assess the vitals, you give a fluid bolus, and then, and this is the most critical step of all, you reassess. The way that patient responds to the fluid will tell you so much about what's really going on. Now, our vigilance can't just stop with vital signs. We also have to be on high alert for specific groups of patients. The ones where even a seemingly minor GI complaint should make us extra concerned. So let's take a look at who we need to watch most closely. When it comes to pediatric patients, there is one giant red flag you have to know about: isolated vomiting. This means a kid is throwing up over and over again, but there's no diarrhea at all. That specific pattern is a huge warning sign for a whole different and often much more serious set of problems. And here is why that warning bell should be ringing so loudly. We're not just talking about a stomach bug anymore. We're talking about potential surgical emergencies, like pyloric stenosis or a bowel obstruction. Or, even scarier, something going on in the central nervous system, a bleed, a tumor, or increased pressure in the brain. So in a child, isolated vomiting is never just vomiting. So as we wrap all this up, it really all comes down to one central idea. The key takeaway here isn't about memorizing protocols. It's about cultivating the right mindset. It's about becoming a truly vigilant clinician. And this is that mindset, all wrapped up in one essential phrase: maintain a high index of suspicion. Those 5 words, they're the foundation of safe and effective practice. They're what remind us to look past the easy answer, to always be on the hunt for those dangerous mimics. So the next time you hear it's just a stomach bug, what else are you going to be looking for?